today we're gonna learn about diabetes. So, diabetes is a long-lasting disease that happens when the pancreas does not produce enough insulin, which is the hormone produced by the pancreas that regulates blood sugar. The pancreas is located in the abdomen. Its functions is to regulate blood sugars and digestion, and uh, to helps in digestion. When the body cannot electively use the insulin it produces, diabetes occurs. Uh, People with diabetes has a higher risk of dying from diabetes. So type 1 of diabetes, there are two types of diabetes, type 1 and type 2. Type 1 is characterized by the lack of insulin production and it is rapidly fatal. And it's genetic, while type 2 isn't genetic. So where's Mohammed Al-Nimir? Mohammed Al-Nimir will explain this diagram for you.
Oh, yes, yes. Okay. Okay. So, your body functions by using glucose. So, your cells have to take in glucose for you to have energy and function normal during the day. And your kidney releases this hormone called insulin, which enables the cell to take in this glucose. So it's basically the key to the cell, as we see in this diagram. So what happens is, in type 1 diabetes, which is a genetic disorder, let's say, that the amount of insulin that is released into the bloodstream is low. It's genetic problem. The kidney does not release enough insulin. So what happens is your cells cannot take in this glucose that is in your blood, and it results in all the glucose running in the bloodstream without entering your cells. Which also, what also happens is your cells don't take enough glucose and you don't have energy. And if you don't have enough energy, you don't function properly, you get dizzy, and it can result in fatality if not treated properly, let's say.
Okay. Type 2
And
diabetes results from the body's ineffective use of insulin. About 90% of people around the world have type 2 diabetes. Most of the results are due to the excess body weight and physical health. Uh, can I explain this diagram? Or don't email.
so type 1 diabetes is a genetic disorder that the kidney does not release enough insulin for the blood. For type 2 diabetes, it is usually caused of being overweight. And what happens is that the insulin receptor on the cells is blocked by the fat because of being overweight. And so your cells become resistant to this insulin and cannot, and basically your insulin becomes pointless, let's say, because you cannot open up the cell because the doorway to the cell is blocked. And you cannot take in glucose because your insulin is ineffective. And the same thing happens where the glucose just runs in your bloodstream uh, without having a function, basically. And you get dizzy, you can't function properly.
Okay. How significant is the problem? More than 220 million people worldwide had diabetes in 2004, and the World Health Organization states that diabetes deaths will double from 2005 and 2030. Half of the deaths occur in people under the age of 70. 80% of diabetes deaths occur in low and middle income countries. Symptoms of diabetes.
First
Mohammed.
of all, does anybody have any questions so far?
Can people? How do younger people get diabetes?
It's usually genetic. If it's
Either if it's genetic or from overweight.
yeah,
I have a question.
yes.
Does like consuming a lot of sugar cause diabetes? Like, um,
Well,
not day to day, but like weekly, maybe monthly.
as we said, like type 1 diabetes is majorly because of genetic and environmental factors. So you cannot have like if you, there's no way of knowing of um like type 1 there's no way of resisting it. It's there. Um, type 2, however, is the only one that you can control, because it's usually caused of being overweight. So consuming a lot of sugar may result in you being overweight and uh, causing making you a diabetic. Let's say. I'm not speaking properly today. Was that
Because
answer?
with the type 2 diabetes, the pancreas still works. It's just that the insulin
Yeah,
has
it's
problems.
infected. Yeah.
Whereas with type 1 diabetes, pancreas is pretty much useless.
Yep. Yes. Yes. Exactly. All right. Okay. So for the symptoms, um, if you are diabetic, your uh, blood sugar level is either too high or too low. But if your blood sugar level is that normal, you're like a normal human being. There's nothing wrong with you. You're okay. But what happens is if the sugar in your blood is too high, um, you end up with frequent urination because your body wants to get rid of the sugar in your bloodstream because it clogs the bloodstream and your body doesn't function properly and it wants to get rid of the excess sugar. And so you end up with frequent urination. And if you have frequent urination, your cells are still not getting the glucose that they need in order for them to function. So your body tells your brain that you are in need of more glucose, which ends up in extreme thirst or extreme hunger. So you're just thirsty all the time because you can't consume the glucose, and at the same time, your body is getting rid of the glucose that you need because your cells cannot take them up. If your sugar level gets too low, um, it's usually because you have too much. No, yeah, it's because that uh, you don't have enough sugar in your bloodstream. You can't feed your body, so you end up fatigued, dizzy, and numb because you don't have sugar in your body. That's it. Any questions? Is that clear? Or did
Yeah,
it go too
quite
fast?
clear.
All right. Next slide, I guess.
Health implications. There are a lot of health complications that occur in your body because of diabetes. Diabetes in the retina. Retina is in your eyes, which is the spot that let you see through your eyes. Occurs when small blood vessels in the retina gets damaged, and this will cause blindness and eventually will develop severe uh, visual complications. 50% of people with diabetes can get damage in the nervous system. Common symptoms are tingling, pain, numbness, or weakness in the feet and hands. Uh, if we combine neuropathy with reduced blood flow, the chance of foot ulcers and eventually they will cut your limb. And here's the foot ulcers, which is a spot that occurs because of diabetes. Uh, Kidney failure also is one of the complications. 10 to 20% of people with diabetes die of kidney failure. It is all diabetes also increases the risk of stroke and heart disease. 50% of people die of cardiovascular disease, which is the combination of heart disease and stroke. Stroke happens when the blood supply to part of your brain is interrupted or reduced.
Okay, so basically, all you can do in order for you to like save yourself from this dangerous disease is basically just take care of your body. Have have a good like take care of your body. Make sure that you're in the right shape. Exercise daily. Exercise is really important, just because you don't want that excess weight to block off the insulin receptors. And most importantly, which is something that uh, people don't usually do, is they get blood tested every now and then, just to make sure that everything is okay and nothing is.
I have a question for you, Mohammed.
Yes.
When was the last time you got your blood tested?
2 weeks ago. No, seriously, actually 2 weeks ago. When did you take the last blood test, Ali?
I don't do blood tests. I can't even remember the last time I did one.
So maybe you should look
I
after.
did it
I recommend doing it. I think the last time I did it was like a month ago.
same
Yeah,
for me.
I
When
think
it
it
turns
makes
out
that
that I'm
everything is okay.
pre-diabetic.
Really,
Yeah.
Rayan?
I tested my blood a month ago, and it turns out that I'm pre-diabetic. Need to do the exercise and care about the prevention.
God forbid.
Diet.
Just basically make sure that you take care of your body, and you will be
Diet's
fine.
important, right?
Diet
Diet
is
is important,
important.
yeah.
Eating good foods, doing exercise.
But like, which is the most important? Is it like diet or
Both. Why are people overweight? Because they don't eat healthy and they don't exercise.
true?
Basically, that's it. Or if they have if genetically, um, they're like overweight because of genetics. I don't actually know what they're supposed to do, but I would say just exercise. I don't know. It's the next slide, I guess. Okay. How do we stop this? As you may or may not know, there's no cure for this disease. It's an ongoing disease, and people who are diabetic usually end up being diabetic when they die. It's really, this is why it's really a dangerous disease, because it's an ongoing cycle and there's no straight way to stop it. The only thing you could do is hope to contain it and make sure that the sugar in your blood is at a good rate. So just control the glucose insulin level. You could buy uh, gadgets, or I don't know what to call these, but it's a machine that
Medications, drugs.
medication, basically insulin therapy. Just make sure like this is a device that you take with you, and you can test your sugar level at any time of the day. I've seen a new device where you put a pin in your bloodstream, and then it's like a small, I don't know what you call it, circle. Have anybody heard of this before?
Yeah, my dad has it.
Yeah, it's basically in your arm, and then you just scan it and check your device, and make sure that your
To test blood sugar.
yeah,
Yeah.
test the blood sugar basically. And insulin therapy. This is where you just make sure everything is okay. Next slide. Ryan, do you want me to do this one, or do you want to do this one?
You can explain this.
All right. So people with type 1 diabetes require insulin. Um, Type 1 diabetes is when there's not enough insulin in the bloodstream. So you put insulin from the outside sources. Usually in the hospital they have the amount that you need. And then this is called insulin therapy. I'm not sure though. I think they call it insulin therapy when you go to the hospital, and when your insulin level gets too low in the blood, they inject insulin into your bloodstream just to make sure that everything is okay. And then people with type 2 diabetes is because of being overweight, and the insulin, even if you put insulin in the bloodstream, I think it does work, but I don't think it's that effective. Um, they do oral medication. Um and also another way you can control your diabetes is blood pressure control. Make sure that the blood flow is okay, and that there's not a lot of sugar in your blood. Next one.
What about the foot care?
Foot
Wanna
care.
explain this?
Yeah, explain this.
You need to inspect your feet daily, bathe it in cold water, be gentle with your feet, cut nails carefully, wear clean, dry socks, because diabetes occurs in your foot and you get foot ulcers and such if you don't care about your foot or while you're in diabetes.
Okay. We control diabetes. Continue. So other ways that you can make sure that uh, if you like if you're diabetes, that you don't that you have control over it is there's a thing called screening and treatment for which causes blindness. So you just make sure that your eyes are okay and that the diabetes is not the blood sugar level is not affecting your eyes in any type of way. Um, there is blood lipid control to regulate the cholesterol levels, and there's screening for early signs of diabetic related kidney disease and treatment. So you basically check on your kidney. So just like to simplify this, just any type of ways to make sure that you don't have any symptoms, and if you do, make sure that you don't have diabetes. And if you have diabetes, there's a lot of ways that you can control this disease.